emotional healing is because of the quote you see on the screen there. You never know how strong you are until being strong is the only choice you have. So trauma is very difficult, but people are a lot more resilient than we think. And so I am looking forward to sharing some of my experiences in working with people that are healing from trauma. I did not choose to be a trauma therapist when I became a psychologist. It found me, but I'm very glad that that's kind of the route I went down. So I'm going to start by telling a story. So on the screen, you see a cat, of course, and this is my cat. His name is Tiger. And Tiger looks very relaxed here, right? Tiger is about 12, maybe 13 years old. In this picture, I think he was around 9 or 10. And I want to show you a picture of Tiger a little later. So this is Tiger a little later. All right. So Tiger started showing some odd symptoms. He was urinating in the sink. And so I took him to the vet. Again, 9 or 10. He's not a kitten. I don't know how that happened. So I'm not sure what part of that story you missed. But some reason my mic went to mute. So anyway, I'm assuming you saw Tiger in the original slide, who's nice and relaxed here, and Tiger again is around 9 or 10 in this picture. And then in this picture, which was around the same age, Tiger looks very different. And so what had happened was Tiger started some odd behaviors like urinating in the sink. So I took him to the vet thinking that he had a UTI, which is what most people would think, some kind of an infection. And the vet said to me that he was having urethral spasms. And she gave me some medicine, which I thought was very odd because the medicine was Xanax. And so I said, well, what would cause that? And her response to me was stress. Usually some kind of stress would cause that. And so I took Tiger home and, started kind of watching him. And I was trying to figure out like why would he be stressed? And I noticed at the same time that he was becoming more skittish. There were some odd behaviors that, having a cat for 9 or 10 years, I had not seen before. Well, what I didn't realize or what I had forgotten was that a few months prior, Tiger had fallen in our pool. And my husband had been working from home at the time, thank goodness for that. And he looked out and saw this thing in the pool and he went out and rescued the cat. By the time I came home from work, he was so sore and tired that he was barely able to walk and he was crawling on the floor. And so I took him, of course, to the vet and they checked him all out and made sure he, didn't have any water in his lungs and all that kind of stuff. But the result or the conclusion that I came to was that he had been in that pool for quite some time for his muscles to be so sore that he was unable to walk afterwards. Tiger is fine today, and that's a question I always get, but it's a great picture of how trauma impacts people as well as cats and animals in general. So the trauma symptoms did not come out right away. And again, that's not uncommon, but they did come out later. And obviously, we had to deal with that. It's a little bit different in dealing with it with an animal as it is with an individual. So I just wanted to kind of tell that story to show how important it is that we recognize the impact of trauma on individuals. So the question is, what is trauma? So it's an individual's emotional response to something distressing. So some kind of distressing experience. Now, I want to stress a few things. One, it can be sudden and it can be unpredictable, and in most cases it is. And in two, that the threat doesn't necessarily have to be physical or emotional inaccuracy. Okay, so what I mean by that is the threat can be a perceived threat. So if an individual feels like their emotional or their physical well-being is threatened, even if it isn't, then that is considered a trauma. And it's not uncommon for someone to have a trauma response. It does undermine someone's sense of safety. So a person normally feels safe, now does not. And not everyone who experiences a stressful event will develop trauma. So everyone is an individual, and we all respond very differently to what could be considered a traumatic event. Some people may not have any symptoms, and some people may have full blown post traumatic stress disorder. So why is it important that we understand trauma? It's because an estimated 70% of adults in the United States have experienced a traumatic event at least once in their lives. So 70% of adults have had some trauma in their background. So that's a very high percentage. So there are four types of trauma that we're going to go over today. An acute trauma would be an intense reaction to a single, usually a time limited event. For an example, a serious car accident, a one time physical assault, a one time sexual assault, the death of a loved one, or a natural disaster, like some of the hurricanes that we went through last year. Chronic trauma is more repeated and prolonged exposure to a highly stressful event. So in that case, it would be something like bullying or childhood neglect or repeated childhood sexual or physical abuse or even domestic violence. Any of those types of things that are repeated and prolonged would be considered chronic trauma. Complex trauma would be exposure to multiple traumatic events where escape does not seem possible. So an example would be sexual and physical abuse, or a person who has been assaulted but also been in combat, because then there's two different types of trauma there. So, um, the person is being exposed to more than one traumatic event, and they do seem to be different. Vicarious trauma is exposure to other people's suffering. And this isn't uncommon for those who work in the helping professions, like first responders or physicians, even mental health professionals, but it can also strike family members and caretakers. An example that I remember of this was when I was working with veterans. I had a veteran who had not ever been in combat. He'd not ever had direct exposure to what would be considered typical veteran trauma or typical military trauma. But he had been part of a rescue mission for a plane crash that had gone into the water. And every time he walked into the mess hall, the body bags for all the people that they had recovered were outside that mess hall. So that was very traumatic to him. Physicians during COVID, and nurses and people that were working with COVID patients were repeatedly exposed to that secondary or vicarious trauma as well. Again, like I said, traumatic experiences can take all kinds of different avenues. It can be any of what you see above: bullying, harassment, physical, sexual abuse, emotional abuse, sexual or physical assault, sudden loss of a loved one, life threatening illnesses, traffic accidents, physical assaults, kidnapping, terrorism, natural disasters, combat, community violence, and domestic violence. And I'll give you an example: life-threatening diagnosis. So at least 40% of patients with cancer diagnosis experience significant emotional distress. So the traumatic elements of the diagnosis include not only the diagnosis itself, which leads to uncertainty and change in perspective of a person's future, but also pain, treatment, test results, and the anticipation, long hospital stays, constant fear and anxiety. So there's a lot that feeds into that experience. A person can So respond to trauma in so many different ways, as I said earlier, and symptoms can range from mild to very severe. They can come on immediately, or they can have they can come on several months down the line, as with the cat. You can have a delayed impact. But psychological distress following exposure to that traumatic or stressful event can be quite variable depending on the individual. And there's a lot of factors that can influence the response. For example, personality, any current mental health conditions. So, in other words, if you already are prone to anxiety and then you're exposed to trauma, it's going to have a higher impact than somebody who's not prone to anxiety. As we talked about earlier, prior exposure to traumatic events, type and characteristic of the event, a person's natural coping skills. So a person who has really good coping skills is going to respond differently than somebody who might have maladaptive coping skills, such as someone who uses substances. And a person's resilience, and a key factor is your support system. What kind of support system do you have to help you while you go through that healing process? Because that process can be very difficult. I'm going to go through rather quickly here, so I apologize for that, but we only have a short amount of time and I want to give you some opportunity for questions. So I'm going to go through some symptoms. We break the symptoms into different categories. Intrusive symptoms would involve involuntary, usually recurrent, intrusive, distressing memories that may come up about the event, maybe dreams. A person can have a dissociative reaction where they feel like they're actually back in the trauma, or flashbacks are the same thing. It's where you actually see the trauma and think you're back in it, so you lose that sense of time. Um, and then there could be intense distress at exposure to things that maybe cues or remind you of the trauma. An example of that would be somebody who's been in combat in the Middle East, where it tends to be very hot. When it's a very hot, humid day, may trigger some significant distress for them. Avoidance symptoms would be then the person goes out of their way to avoid having those memories, those thoughts, or anything associated with the event, or avoidance of any kind of external reminders that could arouse memories, thoughts, or feelings associated with the event as well. Negative alterations in cognition and mood, which includes inability to remember important aspects of the event. So you're blocking it out. And I always used to tell people when I was working with them that if you're having flashbacks, although flashbacks feel really bad because you feel like you're back in that trauma again, you can smell the smells and hear and see the trauma all over again. If you haven't had flashbacks before and all of a sudden you start having them, it's usually your mind and your body telling you it's time to deal with the trauma. So that means you're ready for it. So even though it's not fun and it's difficult and it can be very scary, it is your body and your mind are ready at that point to deal with the trauma. Persistent and exaggerated negative beliefs or expectations about oneself or the world. And what that means is, like, now you have a belief that the world is not a safe place because it was not safe for you. So your whole belief about the world changes. Persistent, distorted cognitions about the cause or consequence of the event that leads to blame of self or others. An example of that is a child who is being sexually abused will often blame themselves for that, even though you and I know that in no way is that a child's fault. The child also is in that egocentric kind of state when at certain ages, and so they do believe that they cause and create the things in their lives. So that it is distorted, and it's something that has to be worked on. Persistent negative emotional state, constantly feeling, you know, anxious, scared, those types of things. Not wanting to participate in activities that you used to like to do, feeling detached or estranged from others, or just not being able to feel positive emotions. Some arousal symptoms would be irritability, anger outbursts, reckless or destructive behaviors such as driving a car fast or drinking too much or using other drugs. Hypervigilance is where you don't feel like the environment is safe, so you're constantly checking your environment for safety. You don't feel comfortable unless your back is up against a wall. So walking into a room with an open back doesn't feel comfortable. It's not uncommon to have an exaggerated startle response, so a person jumps when with the slightest sound. Concentration difficulties and sleep disturbance is a big one, where people just, and a lot of times it's because you're still having those intrusive memories or even nightmares about that adverse incident. So let's talk about coping. Healing doesn't mean the pain never existed. It means the damage no longer controls our lives. So this is really, really important. I never ever call somebody a victim, but rather a survivor, because you're here. You've gotten to be where you are right now. You're going to work, you're existing, you are a survivor. You're not a victim. Yes, at the time you were a victim, but now you're a survivor, and the healing process is where you hopefully are. So again, I just talked about that. Always remember, if you have been diagnosed with post-traumatic stress disorder, it is not a sign of weakness. Rather, it is a proof of your strength because you have survived. And that's something I constantly have had to remind my clients in the past about, and that is that you give yourself credit for how far you've come. I want to stress how important talk is in dealing with any kind of trauma in someone's past. Because there's a much higher chance of having trauma symptoms if you avoid talking about or avoid addressing the trauma. So if a person has experienced a significant trauma or they perceive trauma and they avoid it, they don't talk about it, they don't say anything, they are most likely to have a serious trauma response, including those intrusive type symptoms we talked about earlier, like the intrusive memories, maybe even flashbacks, those types of things. So I really like this quote. Anything that's human is mentionable, and anything that is mentionable can be more manageable. When we talk about our feelings, they become less overwhelming, less upsetting, and less scary. The people we trust with that important talk can help us know that we are not alone. So talking about it is one of the best things that we can do when we're dealing with trauma in a place that's safe, obviously, and with people we trust. And it does help you to not feel alone, because it is a very difficult path. And it does help to be walking that path with support and with other people. Control is a big issue in dealing with trauma, because trauma creates change that you don't choose. So in other words, when trauma occurs to most people, they feel out of control because they feel like they had no control over what was happening. But healing is about creating change you do choose. So in other words, you make the choice to heal through your trauma, and that's when you regain that control. And it's also very, very important that we engage in healthy self-care techniques. It's, taking care of yourself, being kind to yourself, treating yourself the same way you would treat your best friend if they had gone through what you have gone through, or if you are helping someone else. Um, it's important to maintain a healthy diet. And by that, I don't mean eating healthy all day long, but eating one healthy meal a day to get those nutrients in you. Um, Exercise, I don't really want to use the word exercise anymore. I use the word movement. It is important that you just get up and move, that you don't sit around and think about it 24 hours a day, but that you get some movement. Your body and your mind will work together to help you with that healing process. Sleep is important. We talked about that support system, which is the number one barrier to illness. And when we don't deal with our emotional well-being, we do tend to become physically ill. So that social support is key. And it doesn't help us just to have a social support. We also need to reach out to them and ask for that support. Carving out some time for yourself, removing people in your life that suck the energy out of you. And I know we can't always do that, but we can when it comes to choices that we make in our friends and supports. If we're finding that our friend group does not support us, but rather we're the constant support to them and they are draining us of our energy, then we probably need to make some different choices. When it comes to family members and coworkers, if we feel that they're energy drainers, then creating that distance and setting healthy boundaries is very important. In setting healthy boundaries, we can say no, and no does not require a long explanation. It is okay to say, I am not able to do that right now. I don't have the emotional energy to do that right now, whatever it is that you need to say, but you do not need to go into detail to explain. Just, I am not available for that right now. And if an individual keeps saying, asking you why, just keep repeating it, that I'm just not able to do that right now. We talked about being your own best friend, turning those wonderful skills that you have toward others, toward to help yourself, being kind to yourself, growing your spirituality, which doesn't necessarily mean an organized religion, but just believing in something bigger than yourself. And that is a big piece of healing with trauma as well. And then finally, seeking help is not minimal, it is very important. We're going to talk in a minute about it, but I can't tell you how much I want to stress that if you do have trauma in your history or you know somebody who does, it is very, very important that you see a professional because that professional can help you deal with that trauma. And nowadays, there are so many different trauma therapies that don't require you to actually go back and re traumatize. So, really keep that in mind. Therapy is the first line of treatment for trauma. Um, Medication can help manage the symptoms, however, it will not cure the trauma. Okay, it is very important that an individual do attend therapy. It doesn't have to be long term as long as you work through that trauma. And I would highly, highly recommend that you seek a therapist trained in trauma treatment. There's many new types of trauma therapies out there now, so I encourage you to research it. There's EMDR, there's ART, there's ACT, there's all kinds of treatment modalities. And if you're interested in seeking help, go ahead and research those different modalities and find which one you think fits you. Um, Big support for others, a big no is do not ever touch somebody without asking. And the reason that I stress that so much is because you can re-traumatize someone if you touch them and they're not uh, aware that you're going to do that. So, for example, if somebody has been assaulted and then you touch them, it may make them feel like they're being assaulted again. So, just be very careful about that. You can always, if you want to provide support to somebody, you can just simply ask, would it be okay if I put my hand on your arm? Or, whatever it might be, if I held your hand, whatever it might be, just ask. Always create a safe place if you're providing support to others. So all emotions are validated. There are no wrong emotions. So if a person is feeling a certain emotion, it's a real and valid emotion. So create that safe place for them to be able to explore their emotions, show care and caring and concern, of course. When a person feels like you are showing them empathy, then they are more likely to open up. So uh, just show them that you care. And it's simple as just saying, I am concerned and I really care. So I want you to feel like you can have this conversation with me. And all the things that you're experiencing right now are normal emotions. Again, everyone experiences trauma differently, so all emotions are normal and acceptable. Assist in seeking help. Please reach out to your EAP. We have many trauma therapists on our provider list that do all different types of trauma therapy. So please, encourage someone to reach out or help them make that call or send that email so that we can get them connected. And most importantly, take care of yourself and know the boundaries. So, in other words, if you are helping someone through their trauma and you are beginning to feel traumatized and that secondary or vicarious trauma that we talked about, then it's time to take that step back, pass them on to professional help, and then make sure that you get the help you need as well. All right, I know that was a lot of information in a short amount of time. So if anybody has any questions, please either unmute and ask or put them in the chat. I'm here to answer them.